the long-term plan highlights the important role of STPs and integrated care centres and units for delivering improved respiratory care. I think it's important that the STPs have an area where they can go and find the information. There is lots of information around, but they don't know where. And I think that's the beauty of this document that NICE have produced. This whole information package will allow STPs to find where good practice is, where exemplars of the information which has been produced from guidelines is available, and to help implement some of these changes. I think we recognise that during the winter months that there is a huge burden of admissions because of respiratory disease, and they double. And whilst flu vaccination is an important role here to reduce the number of infections, I think we need to perhaps look at other ways as well. And it's not only around COPD, but it's around pneumonia and around asthma. So the big common conditions, and I think it's getting a better diagnosis in the community, empowering patients to deal with their own conditions, and perhaps using their own medication in a different way so that they feel more in control of the condition, they do not call for help, and that can hopefully reduce the number of individuals who feel they need to come to hospital. We know that many individuals, and this is especially so with chronic conditions, have problems with how they cope, and that is not surprising. And I think we also need to recognise that some conditions, such as COPD, are a systemic disease, and people feel ill because of their systemic disease. And also there are lots of comorbidities. So many of the patients with COPD may have heart disease, osteoporosis, diabetes, and it's therefore no surprise that they find that they have difficulty coping. And I think this is especially so perhaps in the middle of the night when they may wake, they're breathless, especially if they live alone, they haven't got a coping strategy, they do not know what to do. And there is so much evidence looking at these long-term conditions, of which, as we say, COPD is one of the best examples, that they have high anxiety and high depression levels, and we need to consider our patients very much in a holistic view. So we not only need to deal with their illness and limit the progression of their illness, but we need to deal with their symptoms, such as breathlessness, such as anxiety, such as depression. Respiratory medicine has perhaps been an area that has not had a national service framework, it's not had a strategy, and I think the long-term plan now gives us that. And many other areas are coming together, so we have the Atlas of Variation, which is soon to be published, which will highlight variations in care. We've got the task force, which has recently produced a lengthy document looking at the patient's perspectives about what they think should occur with regards to managing respiratory conditions. We have some enablers such as Right Care and the Getting It Right First Time programme. And quite often we end up with lots of information, but we don't know where to put it. And we've got therefore a great opportunity as NICE has developed this repository, and it will be supported, and Respiratory Futures are also producing an area where this information can sit, and therefore the new models of healthcare will have an area where they can go and look for information, look for good practice, and think, how can we implement that in our area to improve the quality of care for our patients and to reduce hospital admissions and to take the burden off carers.